How does dopamine agonist augmentation work? Have you ever wondered how dopamine agonist augmentation helps people with Parkinson's disease? This approach involves adding dopamine agonist medications to existing treatments to boost dopamine receptor activity in the brain. In Parkinson's disease, there is a gradual loss of dopamine-producing neurons, particularly in a region called the nigrostriatal pathway. This loss leads to lower dopamine levels, which can significantly impair movement and motor function. Dopamine agonists work by directly binding to dopamine receptors, especially the D2 type receptors. Unlike levodopa, which must be converted into dopamine in the brain, dopamine agonists can stimulate these receptors directly. This means they can mimic the effects of dopamine, tricking the brain into thinking there is enough dopamine present. As a result, patients often experience improved movement control and better management of other dopamine-related functions. Dopamine agonist augmentation can be used in two main ways. It can serve as a standalone treatment in the early stages of Parkinson's disease or as an additional therapy alongside levodopa in more advanced stages. When combined with levodopa, dopamine agonists can help lower the required doses of levodopa. This reduction can be beneficial as it may decrease the risk of levodopa-induced motor complications, such as involuntary movements known as dyskinesia. One of the advantages of newer dopamine agonists is their long half-life, which allows for more continuous stimulation of dopamine receptors. This can lead to better symptom control and fewer fluctuations in motor function throughout the day. Different types of dopamine receptors, such as D1, D2, and D3, play various roles in motor control and cognitive functions. Dopamine agonists primarily target D2 and D3 receptors, which are crucial for alleviating motor symptoms. However, because these medications stimulate receptors throughout the brain, they can also cause side effects. Common side effects include nausea, dizziness, low blood pressure when standing, excessive daytime sleepiness, hallucinations, and changes in impulse control and cognition. These side effects may become more pronounced with long-term use. In summary, dopamine agonist augmentation works by directly stimulating dopamine receptors to help compensate for the dopamine deficiency seen in Parkinson's disease. This strategy can improve motor symptoms and reduce the need for higher doses of levodopa. However, it is essential to manage treatment carefully to balance the benefits with potential side effects. Each treatment plan should be tailored to the individual, considering their disease stage, tolerance, and specific symptoms, always under the guidance of a healthcare professional.